Thank you all again for coming. The focus of today's talk is going to be on an amendment that's going to be on the ballot and that we'll be voting on here in November. And so that's Amendment 69, which is ColoradoCare. And so we've got two speakers who are representing both sides of the issue, who come out to sort of educate us on it, take some questions, and hopefully leave us a little bit better prepared to make that decision on voting day. And so I'm going to start by just sort of reading a couple of lines here from the ballot title and submission clause. So the question on the ballot will be, shall state taxes be increased $25 billion annually in the first full fiscal year and by such amounts that are raised thereafter by an amendment to the Colorado Constitution establishing a health care payment system to fund health care for all individuals whose primary residence is in Colorado, and in connection therewith creating a governmental entity called ColoradoCare to administer the health care payment system. And so the language continues, but I'm going to go ahead and stop there and introduce our first speaker, who will be Freddie. Mr. Freddie, and help me with your last name?
Gaudet.
Gaudet. So Freddie Gaudet is representing Coloradans for Coloradans. This is an organization that's opposing Amendment 69. Freddie was born here and raised here, and he has a number of years of campaign and policy experience, including a year in the state capitol. And in 2014, he worked as a deputy field director in Jefferson County for Senator Gardner's campaign. When he's not in the office, you can find him fishing on a lake near his house or at a ball game with his two younger brothers. So please welcome Freddie Gaudet.
I'd like to apologize first. It's allergy season, so if I seem a little stuffed up, that is why. I'm doing my best. My name is Freddie Gaudet. I'm with the group Coloradans for Coloradans. We are a bipartisan opposition to Amendment 69. And I say bipartisan because we really don't believe this is a partisan issue. It's a vote for or against whether or not you like this plan. It's not a vote for or against the idea of single-payer health care. In fact, we have a lot of supporters, groups like Progress Now, who would normally support single-payer health care, but not this specific plan. And I think that no matter where we live in Colorado, Coloradans can agree that Amendment 69 is not the right answer to the problem that we're obviously facing with health care in this country right now. So this is a really complex proposal, and we'll cover a lot of it today. But if you remember nothing else that I say, remember that we oppose this amendment because we believe that it's risky, it's uncertain, and it's unaffordable. There we go. There's a lot that's not in this amendment that we'll really have to deal with down the road. Things that are left out to an unaccountable board, things that we really don't know while we're voting for it. So we'll kind of cover what Amendment 69 is, what's in it, and then what's not in it, and then go from there. So Amendment 69 sets up a political subdivision of the state of Colorado, like a school board, and it'll scrap all the private health care in the state of Colorado. So if you're on a federal plan like Medicare or TRICARE, you'll remain on that plan. But if you're on a private health care plan, you'll now be on ColoradoCare. It sets up a board of 21 politicians to really set up this plan and institutes a large tax to pay for it. So the funding for ColoradoCare is they're asking for $25 billion, and that comes from two places. There's a payroll tax and there's a non-payroll tax. The payroll tax is split between an employer and employee at 3.3% for the employee, 6.7% for the employer. The problem comes if you look at a lot of the real value creators of the state, small businesses, farmers, contractors, any pass-through entity like an S-Corp, an LLC, because they'll pay the full 10% of that tax, as well as a 10% non-payroll tax. That includes any business profits that a small business makes. They'll pay 10% on that, whether or not those are withdrawn to them. And that's 10% on any other income that's non-payroll, so capital gains, investments, rental property, 10% on all of that. There's also about $11 billion that would usually go to things like Medicaid, and that brings the total to $36 billion, which is larger than Nike, it's larger than McDonald's. So this really will require a large bureaucracy to control, and calling this simple is a bit of an overstatement because it'll be a large program. ColoradoCare is controlled by 21 politicians. Initially, there'll be 15. That's an interim board appointed by the governor and the majority and minority leaders of each of the House and Senate, so 3 each, total of 15. They'll really decide what is in this program, the specific benefits that are given to you, the payments to providers, really the meat of this program. And then there will be in 2019 a group of 21 politicians, so there will be 3 from each of 7 districts, assuming those will be similar to congressional districts, but the interim board will really decide that. And they'll be responsible for controlling the program from there on out. These 21 people will be the only non-recallable office in the state of Colorado, so they have open records. You can see what they're doing, but you really can't recall them once they're in. However, they can vote each other off the board with a simple majority. The problem with that is in Colorado, we've seen how quickly things can become partisan and divided, even when it's a nonpartisan board like a school board. And if that happens on this board, it will quickly become, it's easy for the group in power to remove the group that's not in power. So it lacks a lot of the typical checks and balances you see in our government structures, and becomes an autonomous monopoly of one idea. I also want to mention this is a constitutional amendment, which is not inherently bad, but what it means is that if this doesn't work perfectly, and this is the first time this has ever been tried, we can't just fix it with a new bill next year. We have to actually change the amendment, which requires another process like this. And because it's on the Constitution, it means that if there is not enough funding, which some studies show that there might not be, we really have limited options at that point. So because it's on the Constitution, we're a state, we're not a country. We can't run a deficit, and that's why this is different from comparing this to Canada or any European country, as well as this isn't truly single payer because we'll have people coming in with their own insurance, we'll be leaving, so it's not really truly single payer. But it's tough to compare to a country because we're one state in 50. So if there isn't enough money for this program, or if there's a deficit, that means that the money has to come from somewhere because, again, we can't run a deficit. And the money can come from a few places. Either we can lower the payments to providers, meaning the doctors and nurses will again have to be willing to accept a lower payment from the government. We can lower or change the benefits that are given because the benefits are not actually written into this. There's 11 broad categories of coverage, but no specifics. So those, because they're not in the amendment, those can change down the road, and that'll really be up to the board. Or we can raise taxes. Now, they do have to ask to raise taxes. They have to ask the members of the plan to raise taxes. The members of the plan are not necessarily Colorado voters. It's a separate definition, which means that it'll have to be on a different ballot. It won't be part of the general election because there'll be people voting on it that aren't voters in Colorado. Yeah, we just covered that. And so I mentioned that doctors and nurses will have to be willing to negotiate, or to not negotiate, accept the payment given to them by this board in the first place, and then also, if they have to change that down the road, be willing to do it again. The Colorado Medical Society endorses the opposition to this campaign for that reason. And the problem is that there's a very, word I'm looking for is competitive. There's a competitive market for healthcare in the country, and this makes us less competitive. Because now we'll have doctors and nurses just graduating, having to pay off student loans, and they'll be forced to choose, do I come to a state where I have to accept this payment given to me by the government, or do I look in a competitive market nationwide? And not only do we have to hope that doctors will stay here, because they can either, they can stay, they can retire, they can leave. But it's not just about the healthcare providers that are here now, it's about the healthcare providers that will be replacing those people in 10, 20, 30 years. And if that payment goes down, as we go on, it becomes harder and harder to bring healthcare providers here. Because it's not just about what happens next year, in 5 years. This is on our Constitution, so it's what happens in 30 years, 40 years, what our kids or grandkids will be dealing with as well. And for that reason, it affects the quality of healthcare, because we'll have trouble bringing the best and brightest doctors here. But it also affects the access to healthcare, which we already struggle with in the state. If you go to the Eastern Plains, the high country, people aren't able to access the healthcare they need because there's a shortage of medical providers in the first place, and this will make that more difficult. And for the economic impact of this, now that if you're thinking 3.3% doesn't sound that bad, or 6.7% doesn't sound that bad, $25 billion is really the ground floor of what this can become, because if there's more money needed later on, that $25 billion can go up very quickly, and those taxes have to go up. Medicare grew from 0.01% of the GDP when it began. Now it's well over 3%. If this sees even a small percent of that amount of growth, that $25 billion can become much, much higher. As for businesses, they'll, again, not just in 5 years, but in 20 years, 30 years, have to decide, do I want to put my business in a state where I have to pay an extra tax, or do I want to move to a state where that's not where I don't have to do that? Especially small businesses who are paying on the full 10% on top of their business profits, as well as 10% on their own income. So want to cover residency really quick. The residency, because all Colorado residents are covered by ColoradoCare. Resident isn't defined by this amendment. Actually, in Colorado statute, it varies. There's different definitions for it. It's been said the hope for this is it'll be about a year that you have to live here in order to get coverage from this health care. The problem with that is if you go to places like Boulder, Colorado, great to start it's a great place to start a tech startup. That won't be the case anymore because you'll have to move to Boulder, pay a 10% tax on your business, pay a 10% tax on your income while you're not receiving those benefits, while also paying for private insurance. If you go anywhere else, that's not the case. You don't have to pay that tax. You're just paying for health care. So right now, I don't think anyone's here to say healthcare is perfect. Most people can agree that the system is not where we'd like it to be. And this is a proposed answer to that problem. And what I'm saying is that I don't think that this is the answer. I'm not saying that healthcare is perfect. However, Colorado has made progress in the last few years. We've lowered the uninsured rate about 10%, from about 16% to about 6%. So we're moving in the right direction, but we're not done. In November, you're going to be asked whether or not you think Amendment 69 is the right answer for Colorado. And I hope that you just consider a lot of things we don't know about it, and not just that you've heard you like single-payer health care and that this is that, because obviously not every plan is the same, and there's a lot that is not in Amendment 69 that we will have to hope works out. You'll hear a lot of things that we'd like to do with Amendment 69, a lot of things that should happen, we'd like to happen, but if it's not actually on the document, you're not voting for it. It's about 11 pages long. It's on our website, Coloradans.com. It's also on the Secretary of State's website. And I think both myself and the proponents would both agree that we recommend you read it and see exactly what we're talking about. It's not a bad read. You can do it in half hour, an hour. And it really puts context to a number that you'll see on the ballot, because oftentimes with constitutional amendments, we'll just see vote yes, vote no on 69, 70, 71, 72. There's not a lot of context to that, obviously. And so an easy way to fix that is to do your research, read the amendment, and really decide. And in November, I hope that you vote no. Again, thank you very much for having me. I look forward to your questions afterwards. And that's it. Thank you.
Now representing the proponents of Amendment 69, and you're going to have to help me with your last name, Ron Vejrostek. And so Ron's the owner of Vejrostek Tax and Financial and the author of the book Financially Intact. Making money is easy, keeping it is the hard part. Ron's been doing tax and financial consulting for 35 years and has over 700 clients. He's also life and health insurance licensed and has been for the last 24 years. Ron grew up in Colorado Springs, went to college in Greeley, and graduated from the University of Northern Colorado in 1973 with a business degree. He was one of the founding board members of the Longmont Community Foundation and is currently a board member of two local nonprofits, Colorado Friendship and Special Moments. Ron has been teaching seminars and classes and doing other public speaking type presentations for over 20 years. One of Ron's main missions in life is to help people keep more of their money in their own pockets. Because of this creed and how bad our health insurance industry has gotten, Ron sees the need for a new, more efficient system, and that is why he is backing ColoradoCare and Amendment 6. So please help me welcome Ron.
Thank you. The one thing you may have noticed, he did not say that I am not a politician, and I am not a politician. I want that to be perfectly clear. We are here about ColoradoCare, Amendment 69. The one thing that the opposition will never tell you, the ads won't tell you, doesn't even say it on the ballot, is it makes it sound like your choice is you can either vote for this thing and you're going to pay your fair share of $25 billion, or you could vote no and you don't have to pay it. Well, it's true. You won't have to pay your part of the $25 billion. Instead, what you'll get to pay is your part of the currently $30 billion that we're paying for the currently broken, not working health system that we have now. You can see it. They just finally came up on the website this morning. The new numbers are in for next year, and your premium increases are going to be anywhere between 17% and 42% are our increases for next year. So when we put those numbers into the equation, now we're talking $25 billion versus basically $35 billion. So that's going to be your choice. Which one do you want to choose? I'm going to spend more time than normal on this slide because I think it's really important. Once you understand the problem, the solution starts making a whole lot more sense to you. So it is true they did say, that the uninsured went down all the way down to 6%. What they failed to mention is a lot of those people who were uninsured but now have insurance, the insurance they have is Medicaid. Medicaid doesn't work worth a dang. If you want to go see a specialist or you need to go get a surgery or whatever, you're going to find it very difficult to find a specialist or a surgeon who will accept Medicaid. So it's created a whole new problem is what it's done, and that's the uninsured and underinsured plus the Medicaid insured. So we still have uninsured, and we have about 350,000 of us here in the state of Colorado who still have no insurance. Then you have the big group of the Medicaid insured people, and we already mentioned what that problem is. Then you have the underinsured people, and what that means is that your premiums and your deductibles exceed more than 10% of your income. So even though you can afford to go get insurance, well, put in quotation marks, they afford to go get insurance, even though you could buy insurance, that's all you can afford now. Now you can't afford to go see the doctor because you have a $6,000 deductible and you spent so much on insurance that you don't have money left over to actually go take care of the things. One of the things the opponents will say many times is, well, you don't want to be like Canada and sit there and have to wait for months or weeks on end to get an appointment. You think that's not happening today? It is happening today. A lot of people are waiting months and even years to go get a knee or a hip replacement. Why? Because they're on Medicaid and they can't find a surgeon to do it, or they have no insurance, or they have insurance but they can't afford the $6,000 deductible. All the problems that they say can occur, it's all conjecture. It's all conjecture. They know these problems can occur because they all exist today under the current system that we have. So it's important to realize that the system is a lot more broken. The other problem is, why is this happening? Where we're up to 25% of uninsured and underinsured. What happens is about 20 to 30% of the times the doctors, hospitals, and clinics don't get paid at all, or they get paid a piddly amount. That's called the Medicaid portions. They only get paid some 40% of what they should be getting paid. So what do they have to do? Because, they still have their expenses. They're still taking care of us. They're still providing services. They're doing all those things. Well, they have to raise their prices. Well, as soon as they raise their prices, what happens next? The insurance companies have to raise their prices, right? Except for they have a 20% operational and profit margin. So they not only raise the prices as much as the doctors and hospitals did, they have to put in that extra 20%. What happens as soon as they raise their prices? We have more people who are either uninsured or underinsured. I just looked at the numbers this morning because they finally came out. I live up in Longmont, Colorado. We have one hospital. We have 90,000 people. Guess how many plans we get to choose from for next year that has our hospital in it? Exactly one company. Exactly one. Anthem used to be in there, but they decided they don't want to play anymore. And that's kind of funny because Anthem's also the #1 contributor to Coloradans for Coloradans. Financially, they've thrown over $1 million into scaring you into believing that this is a bad idea and you better vote no. So let's get to what ColoradoCare will do. It will cover every Colorado resident. That part is not established exactly where it will be resident. It could be anywhere from 3 months to a year. That part will be determined by the board as it works out. When you put something in the amendment, it is stuck in the amendment, and we realize that's a problem. So what we had to do is build our structure, and then we put in the details. Let's say 3 years from now, because of inflation, we wanted a $40 copayment for a specialist. Let's say next year we decide, it could have been 38. We couldn't change it to 38. Let's say 3 years from now we need 45. We couldn't change it to 45. Those things have to be controlled by a board, just like every other business is. We're going to spend $4.5 billion, as I just explained, because of the 20% increases across the board on average. It's more like $10 billion now. Private insurance companies won't be deciding what health care you do and do not have access to. And that's the other problem. A lot of the doctors, they have huge complaints right now. They send their patient in for a procedure or a test, and the patient comes back and says they couldn't get it. Why not? Because the health insurance company wouldn't approve it. Or they send them to get a certain prescription. Come back and give me a different one. The health insurance company won't do it. So we already have a board and a whole bunch of unknowns in the current system that we have. There'll be no deductibles under this plan, so we won't have that problem of people waiting years or months, whichever the case may be. There'll be no copays on preventive care and primary care. There will be small copays for like specialists and surgeries and that. It's built into that $25 billion. We worked it out backwards. We figured out here's what it costs to take care of all Coloradans. We know those numbers. And then what's it going to take to make sure we can pay those bills. So it's all been worked out backwards. We know about where it's going to come in. Those co-payments will be very much like Medicare's Advantage plans, if you're familiar with those at all. People traveling outside of the state, you'll still be covered if you're a student or a senior in a snowbird. They say that we didn't specify what the benefits are. We did to a certain extent. In order to make this work, we need that extra $11 billion that's going to come out of the federal government. That is accessible to us through what's called Section 1332. Section 1332 says we have to provide benefits at least equal to the current silver plans. Our benefit schedule at the moment is Platinum Plus, even better than what you could get on the marketplace right now. So we have to, at a minimum, hit the silver plan, which I don't know if you guys know, there's bronze, gold, silver, platinum, the whole thing. So we have to hit at least the silver plans. I won't go through this one by one. There are a couple. I mean, most insurance companies right now don't cover diddly on mental health and substance abuse. We'll be in on that. The palliative and end of care is always another real sticky issue, and of course we're going to help take care of that. So it's going to be resident owned. If you're a resident, it's going to run like a co-op. You're a resident, you're part owner, you're the one who gets to vote on this, you're the one who gets to bring the people in on the board. They keep calling them politicians. I don't know. I guess anybody gets voted is a politician, but that means all the members of all the boards of Anthem and United Healthcare and all those guys, they must be politicians too because they got voted onto their boards. These are going to be local people from your local district who you get to vote on. They say, you know, we're going to be leaving it in the hands of these people. I don't know. It almost sounds like they're saying we're not smart enough to elect good, smart, responsible people to run this board. I think we can. It's going to ensure the comprehensive, high-quality Platinum Plus. We do believe it's simplifying it because right now there's a clinic in Louisville, Colorado. They have 52 doctors. They have 47 people working in the billing department because you have all the different plans, all the different co-payments, all the different deductibles, all the different networks. We're going to get rid of all that. That simplifies things drastically. It'll cost, obviously, significantly less. So how are we going to pay for this? There is the 3.3% tax that we're going to pay on when we get paid, on our payroll. To bring that into perspective, right now, nationally, the average is you'll pay 5 to 6% of your salary goes to pay your portion of your health care costs. So there'll be some savings there, about a third. And once again, there's no deductible, so we don't have to worry about the $1,000 or $6,000 or $12,000 deductibles. The employers will pay 6.67%. Now, to bring that one into perspective, this is huge. On the average, nationally, employers are paying 12 to 13% of total payroll right now for their portion of the health insurance. This is a tremendous savings. Just for example, Denver alone, currently they're paying $109 million as their fair share of the health care premiums.
This is the city?
This is the city and county of
For
Denver.
their employees, though.
Yes. Under ColoradoCare, it would be $52 million for a $57 million savings. Every city, every district, every school district, every county has those same kind of savings, up around 50%. Do you think our school districts and cities and counties could use that money more effectively to be providing us other services, or at least help keep our taxes down? So it's a huge, huge savings. This is where that $4.5, $5 billion, $10 billion worth of savings is going to come from. Also, workman's comp is part disability, part medical care. About 59% of the premium of workman's comp is medical. Well, because we're taking care of all medical for all residents, that part will be able to be separated out, and then therefore they'll only have to worry about the disability. So the employers are going to save money on that end also, especially if you're in a really high industry. So, and then the rest of it is the 10%, and that's on your other income. So that's interest, dividends, capital gains, rental income, like I said, business profits, all of those things are going to be in there. And that's where the rest of the money comes from. but we're not going to pick on the seniors. The seniors will get the same exclusions as they get right now on their state income taxes. So that's $20,000 if you're between 55 and 65, and it's $24,000 if you're 65 and above. Of course, if there's two of you in the household, you get that twice. Plus, anything that's not taxed federally doesn't get taxed on the state. So, Social Security, nobody pays taxes on more than 85% of their Social Security. So that part comes in there too, and that's how we come up with the 30,000, 60,000. Under the exact right circumstances, it can go even higher than that, but it would be uncommon for that to happen. So this is the one that I just want to tell you. This is the one thing we agree on. There's always one thing we agree on. Do go read the amendment. It is true. All of the little specifics are not going to be in there. And like I said, we can't put them in there because it would lock it in for all eternity. And of course, we're going to have to make adjustments over the years. So it provides a fair and cost-effective way to collect the premium and establishes the ColoradoCare principles, and those are two. Every Colorado resident should have access to good health care. This is where ACA and Obamacare screwed up. They made it about health insurance instead of about health care. We believe everybody deserves good health care. The second thing we believe in is all the doctors, all the nurses, all the hospitals deserve to get paid fairly every single time they provide a service. And that's not happening right now. A lot of times they don't get paid at all, and sometimes they get paid on Medicaid standards. Once again, we built it in. We know about where these numbers are going to come in at. They're going to get paid at about 130 to 135% of what the Medicare approved amounts are. Most doctors are pretty happy to get the Medicare approved amounts. We're going 30 to 35%. This is how they get paid now. This is the way all the insurance companies negotiate with them now. They say, here's the Medicare rate, we'll pay you, and they come in anywhere between 105 and 150, and it's usually more in the teens or 20s. We know we have to be competitive. We have to keep the doctors here. It separates ColoradoCare from government control and partisan politics, and we are exempt from Tabor. Tabor says that if you have money left over inside of your division of the government, that you have to give that money back to the people in a refund. Well, we have to act as an insurance company. We have to have a reserve. We don't know when the Zika virus or some other thing is going to come and hit us and we're going to have a really bad year. But we do know it's going to happen. Absolutely. We'll have good years. We're going to have bad years. We have to have the reserves just like any other insurance company would. So this is why it had to be exempted from Tabor. So that's the fast, short story of this. We believe it's simple. It's going to be affordable, a lot more affordable than anything we have right now. If you don't believe that, go look at Connect for Health and see what your premiums are going to look like next year. It's going to shock you, and you're not going to be happy. Quality health care for every Coloradan. I want to thank Chauncey, and I want to thank the group for inviting us here today. It's really great that you guys took your time out of a Saturday, beautiful Saturday afternoon to come and listen to us babble, and I certainly appreciate it. Thank you.
Thank you, Rob. All right, so at this point we have an opportunity to ask questions. The way that we're going to do this is that anybody can ask a question of either speaker, but both will have an opportunity to respond. And so we'll give each 2 minutes. And so let's go ahead and get started. We have a question? Okay. And you guys are welcome to sit up here if you'd like.
Both of you tell us who your largest financial supporters are.
Yeah, I think as I just said, we are supported by the insurance companies, and the reason for that is that if this goes into place, they'll lose all their business in the state. They didn't start this campaign. We actually seeked out donations because the reality is campaigns aren't free. But we are started by Coloradans, we're run by Coloradans. And I will also say that all of the financial info for every campaign is available on the Secretary of State's website. So if you want to look it up, you can see all of our donors, all of their donors. So it's all public information.
We had one donor lady actually put a mortgage on her house. That's our biggest donor. That was about $130,000. Second one is another one of our principal players. That was $75,000. Everything else is smaller than that. We have no million, $500,000, $250,000 donations coming in. It's funny because we're truly the Coloradans that are backing this thing.
Question there?
Yeah, so you said you were truly the Coloradans. My name's Kellen. I am truly a native Coloradan. I actually work for, I'm sorry, I won't say who I work for, but I work for an employer that is insured, that I am insured by one of these insurance companies. And I will tell you that a lot of questions came to my mind as you were speaking individually. First of all, you said, and quote, that diddly squat, or diddly, as he said, is covered by insurance companies for mental health. I will tell you personally, I am currently seeking mental counseling, and I'm getting everything covered by the company that's provided for me. So I'm kind of wondering where you get these facts. And also, the last thing, at the very end, because it's fresh in my memory, you said that Obama and the ACA screwed up because they acted like the insurance company instead of actual health care. But towards the end, you said, as far as defending keeping the money coming back from the table, you said, well, we have to be like every insurance company and keep reserves. So are you not, in fact, doing the same thing you just ridiculed the ACA and Obama for?
No. First one first. So the mental health, and where I come up with that, I have 700 tax clients. Quite a few of them actually are psychologists and psychiatrists and other doctors. And I hear their horror stories all the time. There are some insurance products out there, they're better on group insurance than they are on individual insurance by a far cry. So some products do cover mental health. A lot of them you have to qualify with a condition before they'll continue to do mental health. And a lot of times that's very difficult, such as somebody who might be bipolar may also have another problem, but they won't go seeking after the other problem because they can't be proved because the bipolar gets in the way. So that's where I said that part from. It's just personal experience with quite a few. The second one I did say, in that one respect we have to act like an insurance company and that we have to have reserves. On the other hand, where we're going to be totally different is we are not profit driven. Every other insurance company out there is profit driven. You have a guy sitting there at the table that's going to say, okay, this guy needs this surgery or this test. That's going to cost us money. And he has to answer in the end to the stockholders. Ours is not, we're non-profit. We're not going to make a profit. Do we need reserves? Yeah, it doesn't mean it's a profit. We can also give money back. That's never going to happen with an insurance company. So this board over here is going to be sitting here, and their main goal is to make sure all Coloradoans have good health care. That's what's driving them. So that's, I said, where Obamacare screwed up is they made it about health insurance, not about health care. Our main focus is health care. Thank you for the question.
Thank you.
Do you have a response to that, Freddie?
No.
Let's go with Ralph and then back there.
You had mentioned that Vermont failed. I saw on your flyer you never said anything about that. What were you talking about?
So Vermont's, they tried a plan similar to this, a government-run program. Their governor actually ran on it, their legislature passed it, and then after they passed it, the actuaries said that the 10% tax they'd asked for, roughly 10%, was actually about 50% of what they needed, and it would bankrupt the state. Now I'm assuming that ColoradoCare would say that they've worked out a lot of the things that Vermont failed in, but I would use it as an example to say that typically large government programs don't go under budget, they go over budget. Whether or not they are very thoroughly vetted and planned beforehand, there are things you can't foresee, and that we're the ones that end up paying for that. And so that's what's in the slide, and I sometimes get out of order and forget to mention everything on the slide, so I apologize. Good eye.
Vermont actually screwed up a couple different ways. And just so you know, we have there's 6 of us on the Economic Council team. I'm one of the members of that. For one, Vermont only has 630,000 people to start with. Then they decided to start allowing some exceptions, like this union decided we don't want to be part of it, and this church group decided they didn't want to be part of it. By the time they got done with their exceptions, they had about 480,000 people left. That's not enough to make one of these systems run. We have 5.5 million people, just so you guys know. So the other place where they screwed up is they decided, okay, here's the tax we want to charge, and so they started there. Now how do we provide the benefits? We went just the opposite way around. We looked at what the health insurance companies are paying, what Medicare pays, what VA pays, what everybody's paid for health care. And we know what that number was, and we said, okay, so here's the number we have to have. We know we can get this much from the feds. Here's what's left. What does the tax have to be to make this work? So we learned a lot from Vermont's failure, to tell the honest truth, and we believe we have it right and we can make this work.
Actually, back.
So coming from the point of view where I'm in favor of a single payer system, but skeptical of this plan because of some of what your opposition was saying about us being a state and the fact that our borders are not at all closed and we have no way to do that. So I just wanted you to address that. Like, how do we stop, or how do we deal with the fact that if you have extreme health care problems anywhere in the country, wouldn't it very much be in your best interest then to move here and kind of pull out more from the system than you would put in? How would we stop, doctors leaving if the payments are lower? I mean, you've mentioned Medicaid, like not paying doctors enough. I assume maybe we could fix that, but would that be a problem? Could you address that? And then also, you kind of went quickly over, I'd like to hear more about, if you live here and you go somewhere else, does your ColoradoCare act just like a regular insurance company, or what would stop someone from coming here, getting residency, moving back to where they're from? Let's say you have a family member who's really sick and you live out of state, can you just send them here to like establish residency and then move back? So I am really concerned about that aspect of it, as far as the state becoming a repository of good health care. Even if, if it works really well, doesn't that just start attracting, the most expensive cases to our state, and how does the rest of the state keep that afloat?
So we've already got enough marijuana tourists. We don't need insurance tourists to.
All right, so.
Okay? Okay. So, for one thing, Medicaid, we have what's called expanded Medicaid here in Colorado. We're the only state right around here who has that. And they had that same fear. They said, oh, everybody's going to move into Colorado. What that means is if you're, say, a single mom and you have 2 kids, and you make $40,000 a year, here in Colorado, your kids are covered for free. Go to Nevada, if you make $19,000, your kids automatically aren't covered for free anymore. So they were afraid that was going to bring in all these, single moms and stuff like that with all their kids, so that they could get their kids covered for free, and of course that didn't happen. You have to be a resident. You can't just come get residency and then leave. If you're not back basically in 6 months, you have to have your Colorado driver's license, you have to be doing your Colorado state income tax returns and all that to maintain your residency. You'd have to give up your old driver's license. All those things would have to occur. Also, you have to remember, most poor people already have free health care. It's called Medicaid, and that's all over the place. So then as far as the doctors are concerned, here we actually won't have Medicaid anymore. We will have Medicaid dollars, but we won't have Medicaid as far as health care is concerned. If a Medicaid person goes into the doctor no longer knows that they're going to get paid squat. They're going to get paid the same amount as they would if they saw any other person. So that's going to help all the people on Medicaid, but it's also going to help all the doctors. Like I said, one of our primary goals is we want hospitals, nurses, doctors to get paid a fair amount every single time. It's one of our main goals. That's one of our principles. So, there's lots of scare tactics out there. I'll tell you the one that scares me the worst. Right now, 53% of us are paying 99% of all the income taxes in this country. It's in my book if you want to go find where that number comes from. The healthcare is going the exact same direction. We're already up to 25% of us. It won't be long before 50% of us are paying 100% of medical bills. We're going to pay this tax one way or the other.
So as for your question, how do we keep doctors and nurses here? I mean, we really can't make them stay here. They're free to leave if they'd like to. I will say doctors and nurses are often, we look at them as one group. The reality is they're all individuals as well. They're also patients as well as they're doctors and they're individuals. So there are doctors who are for ColoradoCare, there are doctors who are against it. But having said that, the largest organization of doctors in the state, the Colorado Medical Society, is opposed to this. So it kind of gives you an idea of where we lie. As for people coming into the state or leaving the state, the residency requirement, like I said, has not been decided yet. So whether it is a year and you have to be here for so long, or you can be here for a week, that'll really be up to the board. So we won't know that unless this passes. And then I think you asked what happens if you leave the state with this.
Yeah.
My best understanding, and having listened to what has been said by the proponents, is that if you leave, you are covered up to what has been negotiated as the price within Colorado. You'd be responsible for the difference, and we'll try to get you back to the state as quickly as possible. But while you're somewhere else, you pay the difference.
Okay, are there, would you mind saving it for the closing remarks? Thank you. Are there
I
other
think
questions?
he was first.
Okay, before you do, let's try to get that to one question at a time, just so that people have a chance to respond within their 2 minutes.
To be fair, I was going to ask him the question.
I'm wondering if you could both speak a little bit more to the board and how that's established. It sounds like on the opposition, the side or the sort of the argument is that it's a small group of elected officials who are going to be deciding on this big system for the whole state, which sounds to me like how the government already works. So I'm curious how it's different, and then also if you could speak to that piece of the non-recallable, I guess, about why those elected officials are non-recallable.
Okay. Yeah, so the board, the reason I call them politicians is because they're funded by taxpayer dollars and they're elected. I guess the word is semantics, that doesn't really matter. But the requirement is that they're 18 years old, they live in the district they seek to represent, and they are a member of ColoradoCare. That's not all that different from what it takes to be a congressman or a senator, and I think that saying that they're from our community, so we should always be happy with what they do, is similar to saying that we should always be happy with Congress and the Senate, which is just not the case, whether we vote for them or not. So that's why I refer to them as politicians. And as for the non-recallable, it worries me that there's a lot of checks and balances that don't exist in this board already. They're not accountable to the governor, they're not accountable to the legislature. And then we also can't recall them. And so the idea is that that's supposed to, protect this system and keep it separate. But autonomy, I think, is dangerous. And if they're not accountable to anyone, then I think that's a problem.
The interim board is the 15 appointed members, and they will set up a lot of the rules and regulations. It also states within the amendment that the state legislature has to pass rules to make the whole thing work. The 21 members will be 3 members from each of 7 districts. The districts will be divided up equally according to population. It's going to look more like a city council type vote. And that's why I say we're going to be voting people from our own areas. Not saying that we're not always going to be happy with them or whatever. You can't ever please all the people all the time. But the unaccountable part and the recalls, the unaccountable part, the insurance companies aren't accountable to anybody right now, as far as I'm concerned. They supposedly have to answer to the federal government, they have to answer to the state government, they have to answer to the insurance commissioner, and yet all of them are just making their own rules, such as next year we have exactly 1 insurance company that covers Longmont United Hospital and a town of 90,000. But they're all allowed to sell insurance up there. How is that being accountable? They're not. They're absolutely not. When's the last time any of you got invited to a board meeting at United Healthcare and got to choose whether or not you want your premium to go up? Or if you want a narrower network for next year. So, yeah, are we building a perfect system? No, no such thing exists. But we're certainly not hurting anybody any worse than what's going on now. I'm sure we could build a better one.
All right, next question. Back there, and then we'll go over to Becky and Kimberly.
My question for you was, we've heard a lot of talk about being able to afford this expense, to afford future unknown costs that are coming down the line. My question is, why are we not talking about promoting competitive cross-state line costs to reduce costs, other ways to reduce costs? I see as a person who, like probably everybody else here, pays their premiums, whether it be to the state or whether it be to an insurance company. I want to see my medical costs go down. So that's what I'm primarily concerned with, and I don't think anyone can really disagree with that. And I see that as the biggest problem, because we hear of universal health care in other countries, all the good that does. One of my biggest views on that is, well, they also have lower health care costs than we do in this country. Maybe not all of them, but I know some of them do. So that's how they're able to make that work. So what will both of you, what will both of you do? Is there anything proposed for reducing costs?
So the reason we're talking about this right now, not that, is because this is what's on the ballot. So it's either a yes or a no vote. It's not a this or that vote. And so I'm mainly here to talk about why I don't think ColoradoCare is the right choice. And then But if you vote no on ColoradoCare, I don't believe you're voting for the status quo, because I don't think that's how our country works. I think that saying that if this doesn't pass, then we're stuck where we are and that's it, I just don't see that happening. I think that there's a lot of people continuing to work for healthcare change, and there's a lot of people that endorse us that believe that as well. I already talked about our, the people who support us being very diverse, and that's because a lot of people that support us disagree with each other on mostly everything, except that they don't believe that this is the right answer. And so that's why I'm talking about this, and not how we can lower the cost of healthcare.
And I'm sorry if
What was the second part of the
that well, that was pretty much the question.
Oh, okay.
But also, it's just that that's my question for this whole thing proposed is why are we talking about just kicking the can down the road with who's going to pay for what? Why don't we get a control under cost? I guess that's my question about who is. I know we have to defend this. If you have to defend this if you don't want it, to vote no on it. But the proponents or the people who are proposing this legislation seems like they don't care about costs. So that's my biggest question.
I actually don't believe we can lower costs. What we can do is stop the spiraling up of the costs, as I explained in my presentation. I think that's our number one problem. It's just going up way so high so fast that we can't control it anymore. And they say, yeah, there's other solutions. The cross-state lines, shoot, United Healthcare's in all 50 states, Anthem's in 17, and Kaiser's in 7. I don't get the part about crossing state lines. It's not going to be any different. You still have narrower and narrower networks, not bigger ones. It's not going to happen. And for kicking the can down the road, do you realize somebody has tried to do this legislatively somewhere within the United States every year since 1960? I'm not willing to give them another 50-some years to try and figure this out. I think it's time that we tried now. We've got to figure it out. I swear we can make this work.
All right, now we're going to go over to Becky.
Yeah, I have a question. This relates to employers. And I forget whose talk it was. There was something about a 3.3% payroll tax. Now that would be on individuals, correct? Individuals, okay.
Right.
And then there was employers 6.67% tax.
Correct.
And that would be on what? The
Total payroll.
total payroll.
So just
So that would
look
be
at it
what-
this way, it's always 10%. If you're self-employed or you're making income from interest, dividend, rental, that's 10%. But if you're working for somebody, it's still 10. The employer pays 6.67. The employee pays 3.33.
Oh, I see.
So it
Got
still
it.
comes out.
Oh, that's how it works, okay. So employers then they won't be paying, if they even offer a medical plan, which there's no law that says if you're an employer, you have to give your employees a medical plan. It's not a requirement. I mean, most of them do in some way as a benefit, but I don't know that there's any law that requires them. So they won't be doing that, correct? They won't be offering a medical plan like they do now to their employees.
Correct.
So they don't have that cost. And they won't be paying all the current premium on workers' comp.
Correct.
That will be lowered because it will be just on disability and no medical. The medical will be taken care of separately, which I think is a problem in workers' comp. But anyway, if that goes into more of the general. But anyway, that's my first. So how different then would the cost be with this 6.6%, just on the employer? I'm not talking about what the employee is paying. What difference would that be versus what they're paying now to provide health care, to provide a health care plan, and to provide a full workers' comp benefit?
Okay.
I mean, I don't know if you've parsed that out, but.
Oh, yeah. For one, if you have over 50 employees, you have to offer healthcare. That's just
Oh, it is-
part of
okay, I'm
ACA
sorry.
law.
I wasn't
But
clear
take the
on that.
little mom and pop stores who have a couple of part-timers. I'm self-employed. I mean, I've owned my own business for many, many years. So in my particular case, last year, I was paying $1,354 a month for myself and my wife. Under this program, so that works out to about $16,000, $17,000 a year. Under this program, it would have knocked it down to 9 or 10. I could easily pay the 6.67 on my employees and still be less than what I was paying just for me and my wife before, and nobody has any deductibles. It's a far better plan. So they say, yeah, this is going to drive small businesses out. No, it's not. No, it's not. If they look at what they're paying for their health insurance right now, and when I looked at this coming years, that's really scary. Mom and pops, they're paying anywhere between $1,500 and $2,000 a month, and they have crappy plans.
Yeah, so the 6.67 for a lot of employers will be lower. The question is not, the price is a big part of it, but also what are they getting for it? How will this affect them again in 10, 20 years? But a lot of the small business owners will not only be paying the 6.67 on their employees, but also 10% on their business profits. And so that is a larger number. And I wanted to hit on workers' comp really quick. Workers' comp, only half of it is covered by ColoradoCare, so the medical portion, but not the wage replacement. Meaning that companies that normally do that would have to split their company in half and hopefully be able to just give the wage replacement portion of workman's comp, because they wouldn't have the business from the medical portion anymore. And so it really throws the workers' comp market kind of up in the air. We don't know what will happen. Hoping that those businesses will be able to stay in business and provide the other half of it, but that's kind of an unknown.
Kimberly?
So, when you were talking about Vermont, you mentioned people opting out, including churches, and that kind of made me wonder about what does this, one, is there an opt-out kind of thing for anybody? And two, the churches with the Affordable Care Act were against basically paying for women's reproductive health. What does ColoradoCare do with that? Are we going to be subject to people saying, I don't want to pay for that, so it's not part of the policy, or how does that work?
There is no opt-out. If you're a resident, you're covered, you're an employer, you have employees here, you pay it. So there's no opt-out. It has become a sticking point about abortion issues because there's another law on the books that will override it that says public monies cannot be used to pay for abortions. But when you go look at the statistics, only 12% of abortions are ever paid for by insurance companies anyway. They're always privately paid for through grants or whatever, through different organizations. So even though it's a sticky issue, it's not a big sticky issue. We won't pay for it because we can't by Colorado law.
Yeah, well, it's a big issue for groups like Planned Parenthood, who also endorse the opposition because of that reason, because it doesn't cover abortions and things like that. And maybe it's a smaller number that use that. The reality is that some people do need that. The idea of ColoradoCare is supposed to be that people, everyone's covered for everything, but that's not the case here. They won't be covered, so it is similar to that. I'm sorry, what was the first part of your question?
Oh, the first part was the opt-out.
Okay, yeah, and then there's no opt-out. If you move or you don't make any income, I guess. If you make income in the state of Colorado, then you're taxed. There's no new exemptions within ColoradoCare. All the exemptions exist already in tax code, and that's where the Social Security one comes from. So it's not like you're getting a new exemption for that. You have the same exemption, you just pay taxes on what you would normally pay tax on.
Why a constitutional amendment? Why not just a statutory change?
Because like I said, it's been tried almost every year since 1960. The insurance company has always come in. Insurance industry spends 3 times more on lobbying than the military complex industry does across the nation.
But that doesn't change it if it's if it's going to the voters. There's really no difference between constitutional amendment and a statutory.
The statutory amendment is done by the legislature first and has to get out of committee, then be put on the ballot, then be brought to the voters.
You can't bring one of those directly from referendum?
No, the only way you can do it is from our side. If the citizens put up for an amendment, then it has to be voted on. If you try and do it statutorily, you got to get it through the committees and all that first, and it's never made it. There's one poor guy in New York. Every year since 1992, he has tried to get it through in the state of New York, and he's yet to even get one out of committee.
Aren't there statutory referendums though?
I think
Here?
there are.
Yeah.
Freddie, can you speak to that?
Yeah, I'm pretty sure there are statutory referendums. I don't want to, look that up because I don't want to say it as gospel. But as for why it was done as an amendment on the proposition, that's really the opponent's choice, not our choice. I will say that it didn't get to the legislature for a lot of reasons and had bipartisan opposition, not just you assume that the right's going to vote against it. That wasn't always the case.
Statutory referendum takes a majority vote of both houses of the legislature. That's never going to get accomplished. Somebody's getting up on that.
All right. Do you have
Can
other
I just
questions?
amend real quick on that? Would your opinion change if it wasn't a constitutional amendment?
It would change a little bit. I'm not going to say that I support it, but my opinion would certainly change a bit. I think I have more than one issue with it other than just that it's an amendment, but that is one of my issues.
Okay, we've got a question back there, and then Ralph.
I'm just wondering if you could each just say what you find most convincing about the other side. So, like, what do you think the biggest risks are, and like, what could actually bring down? Even if you think it's a good idea and it will work, what do you think might be the potholes that'll throw it off? And what do you think are like the best parts about it? Where like, if we could solve these problems, and like maybe it would work. You're skeptical, but like maybe it would.
You go first, Clay.
Okay. Well, just like the proponents, I also want everyone to have healthcare, and I want everyone to be covered for what they need to be covered by. And I would, if this passes, obviously, I would be a patient, or I would be a member of ColoradoCare. And so I certainly hope that a lot of the things we're being told about it are able to happen. I hope that the money is there, because I also want people to be covered and have the insurance that they need.
One thing that scares me the most, and a few of us, is ever letting the lobbyists come back in and try to buy out that board somehow. So there's already a team at the top. We're hoping one of the very first things that gets passed, either legislatively or through the first 15-member board, is that there'll be no campaign funding for this, so that'll keep pressure coming in from lobbyists. That's the one thing that truly does scare me and a bunch of the rest of us. So we're already considering that.
How could the board pass something like that and not have it overturned by the courts, though, on like Citizens United grounds and stuff like that?
If we could get the it says inside the amendment that the legislature has to write laws to actually make this thing work. So if we get them to write it right into there, like say, you can't have campaign funding, but it's limited to $1,000. Something like that. Just enough to keep the insurance companies from trying to buy their way back into this thing.
Freddie, do you have a response?
Thanks for
to
that
comment?
question.
Okay. Ralph?
One of the things that I see as a big problem with the Social Security taxes is that it's very regressive because of the cap that's on there. I noticed that this has a cap as well. Is there any chance that that'll ever go away?
Now, it's written in the amendment that what the cap he's talking about is if you're single and you make more than $350,000, you don't have to pay 10% on anything above the $350,000. If you're a married couple, it's $450,000. Yeah, no, the cap's not going to go away. It's written into the Constitution. You also have to know that's less than 1% of our population makes more than that kind of money.
Yeah, but even so, that does make it regressive, though.
It does. Every tax we have in our nation is regressive. I hate to say that, but it truly is.
But what they're proposing is to perpetuate that, and I didn't see any need for putting a cap on there.
Yeah, you're not the first person who said that, and I'm not sure I would agree or disagree with you, to tell you the truth, because I'm not up at that level.
All right.
Yeah, if it's written into the amendment, that can't be changed without a vote of the people again.
Okay. You may have a question there.
Yeah, both sides have acknowledged that this is not a flawless plan, so I'm curious, in your opinions, what a better plan would look like.
Could you repeat the question a little louder?
Yeah, I just said both sides acknowledge that it's not a flawless plan, and so I'm curious what a better plan would look like.
I'll be the first to say I wish I had the answer for the perfect plan. That would be fantastic. As for a single payer, I think that specific kind of plan works better at the national level. At the state level, it can be tough because we're 1 in 50 states. But I do wish that I could tell you what the perfect plan was for healthcare.
Being that you're all atheists and agnostics.
We're not all.
The only perfect plan would be a God-given one, I guess, because we're all humans and we're not going to be perfect. We're coming as close as we can, but we obviously know, we can't, nobody can build a perfect plan. So we're going to come as close as we can.
It's going to be our last question, but we will have time afterward to talk further.
Can I ask a complex question?
Go for it.
Okay. One is, I've heard of the debaters talk over and over again about how a national plan would be better, but not a state one. But didn't Canada start one in Saskatchewan? Was that not a state starting a plan and the whole country eventually taking it up? And number two, I'd like to know how much they're paid from their campaigns.
Okay, wants to start?
I'd like to say I did not pay her to ask that question. Well, I've never met her before, but thanks for that. Canada's did start in Saskatchewan. They had the exact same fears that all the doctors were going to leave, Saskatchewan ended up with more doctors. The people liked it. The rest of Canada said, that's not so bad, that's working pretty good, and it went state by state and became national. I am not paid anything. This is all on my own dime. Always has been.
I think trying to do this with Colorado and hoping that everyone else does it is a big risk to take with our state, and really making us the test so that everyone else can hope that it works, which is, it's a risk to take with our own health care, with no guarantee that that'll happen nationally. As for what I get paid, I'm not going to answer that. I will say that this isn't my job. I'm a political contractor, so I get to choose the issues that matter to me and then join those campaigns, but that's all I'm going to say about that.
I'm going to allow one more question from Becky over there.
Real quick question, probably quick answer. What is the position of the Colorado Medical Society on this? Have they taken a position?
Yeah, they're opposed.
Can I expand that just to say, could the proponents say more about who supports them? Because the opposition has dropped a few different organizations and stuff, and former governors and stuff. So I just want to piggyback on that and just say a little more who supports which side.
I'm really glad you re-asked that question. The head of the CMS is against this. I've done a couple of debates, like the Boulder County Medical Society, and that one was actually fun. It was all doctors, all nurses, all practitioners. And we did a poll beforehand. It was 38% for, 38% against. We did the poll afterwards. It was all electronic, done. And it was 59% of the people were for it at the end of it. We've done that several times around the state, and we keep coming up with the same answers. Also, you'll find that the major Chamber of Commerces are against us. But like Longmont's, for instance, Longmont United Hospital is a huge part of our Chamber of Commerce, and so they have a whole lot of sway. When we talk to small businesses, once they get it, we get a lot more support from that. A lot of our donations, go look, he said it, go look on the Secretary of State side. You'll see who's put money into each side of the campaign. You'll see there's a lot of small businesses and a lot of individuals who've put in. Over 98% of all our money came from small people. 98% of theirs came from the big out-of-state insurance companies who are trying to protect their profits.
Can I do one? I like to pitch our website one more time as well. Coloradans for Coloradans.com. And we do have a full endorser list. So you can see all the individuals who support us, the doctors, as well as the organizations, the businesses. That's all under the endorsement page on our website, so you can see the full list.
Is that for FOR or the number 4?
FOR.
Oh,
Coloradans for Coloradans.
You never know these
If
days.
you write Coloradoans, you won't find it. It's
Oh,
a
thank
mouthful,
you.
it's a pain to spell, and I have to do it every day, and I hate it.
All right, and I want to give our guests an opportunity to have closing remarks. So we're going to start with Freddie.
Okay. Again, thank you very much for having me. I appreciate the opportunity because these are really important to talk about. Amendments, we often just see a number and we don't put any context to it, but this is a big deal whether you vote for or against it. Healthcare is an important issue, and the fact that you're taking interest in it is very important. Again, I believe that this is risky, it's untested, and it's unaffordable. We're taking risks with our own healthcare, hoping that everyone else will follow. This has never been done before. There's no real plan to compare this to. We can't compare it perfectly to a country who does it because we're not a country, we're a state. And there's a lot of uncertainties. There's a lot of, we hope this will happen, we'd like this to happen, but if it's not an amendment, you're not voting for it. We have to do a lot of hoping that this will work out. And so I hope that you'll vote no. We can go in November because we were voting for or against a plan. You're not voting for or against the status quo. That's assuming that nothing happens after November. That's just untrue. Something will happen. You're voting for or against this plan. And thank you.
Thank you. And Ron.
The system we have right now is risky. We don't know what's going to come next year. Well, now we do as of today, but the year after that, we don't know what our premiums will be. We don't know what our deductibles will be. We don't know what our networks are going to look like. Unaffordable, yep, the system we have is totally unaffordable right now for more and more people every single year. Unaccountable, we already covered that too. So all I have to say is this. If you want to pay your fair share of $25 billion, then go ahead and vote yes on Amendment 69. If you'd rather pay your fair share of $35 billion, then vote no on 69. If you want to have no deductibles, vote yes on 69. If you're in love with those $5,000 and $6,000 and $12,000 and $13,000 deductibles, vote no on 69. If you want to be able to go see any doctor you want because there are no more networks, vote yes on 69. If you like this narrower and narrower network system that's running right now, vote no on 69. I hope you guys will join me on November 8th and vote yes on 69. Thank you so much for your time today.
All right, let's give our guests. Okay, so before we break up, just want to let you guys know, again, we do have some events coming up. Next week, we've got the event with Freedom from Religion Foundation, where Eddie Tabash is going to be coming out and speaking. Tomorrow, if you want to come back here and continue the conversation, come back at around 10 a.m. for Coffee and Community. It's always a good time. If you have any questions, feel free to ask and continue the discussion. Doors will stay open for a while. Thank you guys for coming.
Yeah.